Hello friends, Dr. Sachin here again from Yashoda Hospitals, Hyderabad, cancer specialist, senior oncologist and robotic surgeon. So as the patient comes in my room for cancer detection, cancer treatment and various further discussion, they ask me very important thing is, okay doctor, why it came or how to prevent it, what are the risk factors. So let me explain you in this video what are the general risk factors for cancer. So there are four groups. One is behavioral, then environmental, then hereditary and then biological. So let me explain one by one. What is behavioral? Like our habits. For example, smoking, tobacco chewing, gutka chewing, pan chewing, or smoke, or alcohol, or less diet of less nutrients of high fiber diet and more of deep fried items, proper lack of proper exercise or physical activity. All this comes in our behavioral reasons or risk factors of cancer. Second is environmental. For example, pollution, then chemical exposure, ultraviolet rays exposure, or sometimes second hand smoke, pesticides, fertilizers, all these preservatives, all this comes in second group of the risk factors. Third is biological. And what is biological? That is race or gender or age of the person. For example, high age or 60, 70 age of people, they are automatically more risk for cancer. And fourth is hereditary, what we call as familial cancer. Suppose in family there are more than 3 members or more than 2 generations, if there are multiple cancer patients, then obviously the risk of having cancer in the next generation is very high. So all these are risk factors for the cancer, and the best important thing is 75% of the cancer can be preventable if we are aware about the risk factors and if we prevent the exposure of the risk factors. For example, the behavioral risk factors, the environmental risk factors, all these are under our control. We can reduce our smoking or tobacco or gutka or alcoholism or stop it completely. Then we can increase our physical activity or exercise. We can take good fiber diet and avoid the deep fried items and bakery items. These are under our control. Exposure of radiation, exposure of chemicals, pesticides, all these are under our control. Of course, the hereditary and other genetic factors, they are not our control, but whatever we can reduce, definitely we should reduce to prevent cancer. I hope you understood what are the risk factors for the cancer and how to prevent them.